Dr. Beccy Cooper. Thanks so much, and thanks so much for being here this morning. So I'm going to gently continue to move you from the hospital to the community and then along to prevention shortly. But just staying with the community, I just wanted to pick up on a point that Andrew made and Danny had made previously about capital investment. As you all know, hospitals are very large buildings and house a lot of people and do a lot of good things. If we're moving from hospital to community, I wonder if you could talk a little bit about the capital investment that you think is going to be necessary. I hear what you're saying, Tom, about virtual wards. They're great. I've worked in them myself, but I'm also very aware of the need for community infrastructure to deliver a hospital to community shift. So I'd be grateful if you talk about that for a couple of minutes.
Yeah, I think the consequence of the undercapitalisation of the system that Darcy described in his report is that right across the NHS estate we see real challenges, and obviously hospitals have been put into the spotlight because of the new hospitals programme and the promises made by previous governments. But if I think about the primary care estates, mental health estates, I am worried, to put it mildly, about where we are. That's why I was delighted, because of the choices made by the Chancellor in the budget, that we will have over £100 million next year for around 200 upgrades for existing GP surgeries, which will create both additional space and boost productivity. This is the first national capital fund for primary care since 2020. Now, I'm not pretending that 1 year capital allocation of £100 million will have solved all of the problems. But I think, again, it is showing through action, not words, that we are serious about the shift from hospital to community, and that we are recognising the pressures in primary care specifically in that context as well. So I hope that will start to make a real difference and provide some light at the end of the tunnel to a part of the profession in general practice, which I think have been extremely demoralised, to put it mildly, given their experience over recent years.
Okay, interesting, thank you. So if I can just move on, and I'm aware of time and other colleagues want to get in, but I just wanted to shift you ever so slightly in a happy cultural shift over to prevention, but still looking at primary care. So a recent King's Fund report highlights the emerging consensus that a health system based on a strong primary care infrastructure and a strong public health sector is essential to maximise the health of the population. But despite the fact public health and primary care are mutually reinforcing, they are organised and funded as two separate entities. So, Secretary of State, do you see value in bringing the funding for these two areas together? And if so, what do you see the role of the public health grants continuing to be in local authorities?
That is an interesting question, and definitely exactly the sort of debate we should get into through the 10-year plan process as well. I have a particular perspective to bring to bear on this as a former cabinet member for public health, and I will probably bring in Tom if he wants to, as a very recent chief executive of a city council in Leeds. I think we definitely need to see better joint system working. I'm not sure the solution, though, would be to take public health out of local government and put it into the NHS. I mean, I'm open to the arguments, and in the spirit of the 10-year plan, I think these are the sorts of debates we ought to be having, and I think it would be a good kind of discussion to have, including in Parliament, in the fora we have available to us in different places around the place. But I think the public health delivery of local government is important. It's amazing, frankly, what local government is still able to do despite their experience over the last 14 years, and I experienced some of that during my time in cabinet in local government. I actually think the pandemic showed us when the NHS was reaching the limits of its engagement with communities on things like the vaccine rollout, and they'd motored really well and then bumped their head against the ceiling on the rollout, and they started to struggle to go further. Local government had much better relationships into communities, including the ones that Danny was describing about earlier, those places that are not hard to reach but are underrepresented and underserved by the NHS. Local government was the route in. So I think there's a lot to say about the effectiveness and the reach of local government that the NHS could partner with effectively. We'll be making the public health grant allocations shortly. In fact, I'm happy to say we'll be doing that in January, which is earlier than it normally comes. That will give people the chance to plan ahead. I do think there is a role for GPs to play in population health management. And I've been back to Matt's point a short while ago about the hospital to community pressures and how we're managing them. Like, one of the reasons why advice and guidance is so important in relation to general practice is people are seeing patients now with increasingly complex multiple comorbidities. And actually I think the role of the general practitioner becomes more important, not less, over the coming years and the coming decades. And so we can continue to treat those symptoms of chronic disease, but we've really got to shift to the prevention as well. And I think general practice has a powerful role to play in that. Tom, I don't know if you wanted to say anything on local government.
Yeah, thank you, Secretary of State. I just to agree with that and say the role of the third sector is critically important in this space as well. And local government holds the main relationship at a local level with the VCS sector. And if you think about those connections you can make to people, older people who, want to stay in their homes and live independently longer, it's often the third sector the local charities who can really connect into them better. And the same for people with addiction problems. When you look at the collaborations that work best involve the NHS, GPs, the NHS, local government and the VCS. And so I think the funding will always come in a slightly different way to each of them. But I think what we're really interested in is how do we make it easier for people to collaborate once that money's there, and make sure that you've got all of those partners working together. And that's where the neighbourhood health service idea is a really exciting one, I think, because that could be the vehicle that we use to drive that sort of reform that the Secretary of State has articulated.
Thank you. Oh, sorry.
I was just saying, it's also why ICBs are so important in all of this, and why that structure which brings together those partners is so critical moving forward.